morning. We're gathered today on the traditional territory of Treaty 6, and I acknowledge the Métis people of Alberta who share a deep connection with this land. I'm Laurie Sigurdson, the MLA for Edmonton Riverview, and the Alberta NDP critic for seniors issues, continuing care, and home care. I'm joined today by Ray Rideout, who was shocked to learn that he would need to wait more than a year for a diagnostic procedure for his heart. We'll hear directly from Ray in a moment. Ray is one of many Albertans who have been impacted by the challenges in our struggling healthcare system, a system that Danielle Smith claims to have fixed. Well, on Wednesday, it will be 300 days since the Premier promised Albertans she would fix our healthcare system within 90 days. She didn't. Almost 6 months ago, Danielle Smith told Albertans that Alberta Health Services was no longer in crisis. It very much still is. Ask any health professional, and they'll tell you healthcare in Alberta is in deep crisis. Ask any patient in Calgary who has tried to book a timely appointment for routine lab work. Ask the people in communities throughout rural Alberta where their emergency departments continue to experience temporary closures on a regular basis. Since the beginning of this month alone, staff shortages have impacted emergency departments in Boyle, Lac La Biche, Beaver Lodge, Smoky Lake, Rocky Mountain House, Milk River, Ponoka, and Spirit River. Ask the hundreds of thousands of Albertans who still do not have a family doctor. Ask any patient confronted with agonizingly long wait times for surgery. Ask any Albertan seeking emergency care where wait times to see the doctor are routinely spiking to 12 hours and beyond. Yet, Danielle Smith continues to ignore all of it. Even data from the UCP's own annual report shows that despite their claims, they've been falling behind on surgeries. Broken promises and lies. That's a response to this crisis from Danielle Smith and the UCP. To share his experience, I'll turn things over to Ray.
Morning. I've had a heart condition for about 9 years, and it's mostly relating to a valve in my heart that's been malfunctioning. But it's been under control for the past 9 years. However, about 8 or 9 months ago, I started to get some new symptoms, and I ended up dealing again with my cardiologist. He diagnosed the problem pretty quickly and gave me some medication for it. But he said, you know, we'd better do some more testing to see what else is going on. So through the winter and spring, I had a battery of tests, and nothing conclusive came out of these. There was nothing alarming, certainly. And I thought that things were probably settling down. My doctor said, you know, I think we need to run one more test. So he said, you'll get a note in the mail, and that will indicate when and where and so on. So I thought, well, that's very good. Near the end of May, I get this letter in the mail. It says, Royal Alex, middle of June. I thought, well, that's pretty good. In 3 weeks or so, we'll know where we're going. So I was about to put it on my calendar when I noticed that the date and the day didn't match. So I immediately called the cardiologist, and I talked to his secretary, and she said, oh no, she said, it matches all right. You're looking at the middle of June 2024. I couldn't believe it. What a year to get some diagnostics done on my heart. Didn't make any sense to me. So I said, well, what's that all about? She said, well, that's what the waiting list is these days. And I said, well, is there any way I can speed it up? I don't want to be left in limbo for a year. She said, well, not really. She said, you can call the hospital and tell them to put you on a short call list. Maybe that'll work. So I did that, but still I'm stewing now because I don't know how long I'm going to be left on tenterhooks waiting for somebody to tell me what's wrong with my heart, if anything. So I started talking with my GP about it, and he says, there's nothing I can do. He says, there's no way to speed up this process. It takes as long as it takes. So I thought, well, is there anything that I can do? Is there any way that I can get it done privately by paying out of my own pocket? I didn't like the idea, but I thought, this is my health at stake here, and I just don't want to let this thing fester for all this time. He said, well, let me investigate. I gave him the copy of the requisition that I got from the cardiologist. He faxed it to this facility down in Meadowlark, and indeed, in a few days, I got a call back from them, and they said, yeah, we can fit you in a couple of days' time. And I asked how much it would cost. $650. Well, $650. I mean, I can manage to pay that, but I thought, this makes no sense. Again, why, if there is a place available to do this diagnostic test, there's a place available, they have space, why do I have to pay $650 now? Well, I mean, eventually I just said, well, I'm going to eat it because I really want to know what's going on. So, sure enough, I go there, and in about 20 minutes the test is done, and in 2 days they give me a sheet of paper saying, here's the results of your test, here's what's wrong, and here's what needs looking at. But because they give it to me, it's no good to me. I can't read all this medical jargon. So here I am now. I've got the test done. I'm ready to hear what the cardiologist says. So try to find the cardiologist. Gone away for the summer. Back on September the 28th. So, I'm still now in a situation where I don't know how seriously my heart needs attention. I don't know what needs to be done, if anything. I don't know if they need to do some kind of intervention, either a minor one or a major one, and I'm waiting now until the end of September to see my cardiologist, and I'm just hoping for the best, of course. But I mean, the problem of the wait list is, it is, I suspect, killing some senior citizens. It's certainly stealing quality of life from us, because we have to wait all this time just to find out whether we need treatment. So that's my story.
Okay, thank you. So thanks so much, Ray, for sharing your experience with us. Albertans have a right to some answers. So I'm calling on Danielle Smith and AHS Administrator John Cowell, or heck, even the Health Minister, Adriana LaGrange, to show their faces in public today and explain why Ray should have to pay for a test to find out if his heart is working properly. They can also explain why it takes 12 hours to see a doctor in an emergency. And they can explain to hundreds of thousands of Albertans why they don't have a family doctor. And they could admit to Albertans that healthcare in this province is in crisis, and their plan to fix it has failed. The Alberta NDP is ready and willing to share our plan for primary care with the UCP government and get to work immediately to end the chaos and crisis in our healthcare system. Healthcare workers deserve a government that supports them, and all Albertans deserve healthcare that is there for them when and where they need it. Thank you, and we're happy to answer any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start in person.
Hi, Catherine Gurkowski, Alberta Today. I think this question would be for Ray.
Okay.
I'm wondering, did you do any follow-up? Did you take the results to your GP at all, or did you follow up with the clinic where you got the test done, since your cardiologist's not available?
Yeah, the clinic where I got it done, they don't deal with any therapies that you need. I did take it to my GP, but he's on holidays too.
Oh.
So I saw a GP who was replacing him, and he said, this is something that you need to talk to your cardiologist with. So.
And you'd mentioned that you did get some other tests and were on medication. Have you seen an improvement since that initial treatment, or is there still this mystery?
Well, no. I mean, what happened was they put me on a medication that prevents blood from clotting. It's a blood thinner, essentially. So I'm somewhat assured that I'm not going to have a big crisis anytime soon, but my heart is still functioning at, I don't know, maybe 60% capacity. I mean, the side effect of this issue is fatigue, no stamina, and feeling pretty crappy at times.
Okay, we'll do one more pass for questions. Raise hand on Zoom, *9 on the phone. Catherine, any further questions? We're all good then. Thank you, everyone. This ends our press conference for today.